Come in.
Hi, Jackie.
Hi.
How are you?
Good.
My name's Amy. I'll be taking care of you tonight.
Okay.
I'm one of the RNs on the floor, so if you need anything, just ask. I'm here till 7 a.m.
Okay.
Okay, you're stuck with me.
All right.
I have a few questions to ask you. I'd like to listen to your lungs and belly and see how you're feeling, and then I'll let you rest. I know you're tired.
Okay.
It's been a long night.
It has.
Yeah. So, if you don't mind me asking, when was your last bowel movement?
Yesterday, I believe.
Okay, great. Have you ever had history of abdominal surgeries in the past?
I had some C-sections with my kids.
Okay, but that's it? No other surgery with your intestines or anything?
No.
Okay. Passing gas okay?
Mm-hmm.
Oh, yeah. The reason I ask is because I didn't know if you had abdominal issues at all.
Yeah, not usually. After I had the kids and I had some pain issues, they told me until it healed that was normal.
But that's surgical pain.
Yeah.
Okay. You know history of like Crohn's or anything?
No.
Okay. All right. That can be very painful, so that's a good thing. Any problems tolerating your diet?
No, I eat just a regular diet.
Okay.
I don't really follow anything special.
Okay, no diabetic diet or anything? Okay. Any nausea, vomiting, pain after you eat?
No.
Okay, great. I'm going to listen, and then I have a few more questions for you, okay?
Sure.
Okay, I hear some good bowel sounds.
Good.
All right. Do you drink anything containing alcohol, Jackie?
I can't say I don't have a drink. Once, twice a year on special occasions.
Okay, so occasional, it's not no daily. Okay. Ever drink 6 or more drinks?
Oh, I'm sure I have.
Okay.
I don't make a habit out of it, though.
Okay, all right. Now, any issues with your diet in consideration to like healthy eating? The reason I ask that is because the more abdominal fat that you carry, the higher risk you have for other issues down the road.
I mean, my doctor and I have talked, several times about, following probably a healthier diet. I would call it, balanced. I'm trying to get there.
Okay.
Make subtle changes.
Right.
So
Fruits,
healthy.
vegetables,
Right.
high fiber.
Yeah, I'm cutting down on all the sugary drinks.
Good.
And, things like that.
I know it's hard.
Yeah.
It's harder than it seems.
Yeah, I work night shift too, so caffeine is my friend.
I hear you. I hear you. Okay. Any history of asthma or any respiratory issues?
No, actually.
Okay. All right. Any in your family or anything that?
I do have some family history of asthma, and like my mother and one of my brothers, but it's not a heavy history. We just have it, periodically.
Okay, so you don't have like a chronic cough or anything. You're not bringing any sputum up.
No.
Okay. Have you had your flu and pneumonia vaccine this year?
I had a flu vaccine this year. I didn't know anything about a pneumonia vaccine. Is that something I would get?
Probably not, considering that you're not, you don't have asthma, and considering your age, you're only 30, so, there's no indication to really get the pneumonia vaccine at this time. You have plenty of time for that. Down the line, if you develop something that, that puts you at a higher risk of getting pneumonia, then that would be something to consider with your family doctor. But for now, no, and I'm glad that you got your flu shot. So, even though, we're done the season now, you'll have until next year to get it. So that's good. Any shortness of breath with exertion? Walking up flights of steps?
I do.
Running?
If I walk up a couple flights of stairs, I
Okay.
do get a little short of breath, but it passes pretty quickly.
Okay, how quickly would you say?
Maybe 2 minutes, a minute, 2 minutes.
Okay. Is it like a severe shortness of breath, or you
No,
just feel
just a little winded.
Okay. Okay. No chest pain or anything?
Mm-mm.
Okay. Do you smoke?
No.
Good. Good to hear. Too many people do nowadays. So,
For sure.
Yeah.
It's too expensive.
There you go. It's cheaper not to.
It's a,
Where do you work? Do you mind me asking?
I work in a hospital, actually.
Okay. Are you around any chemicals or things that wouldn't be good for your respiratory system?
No, we have patients that have, sometimes isolation, but we wear our mask and everything, just so.
Okay.
So.
All right. So you feel like you're protected that way?
Yeah.
Okay. No, like I said, you're not around a lot of chemicals or
No.
anything hazardous.
No.
Okay. Okay. Let me listen to your lungs quick.
Do you need me to sit up?
Sure. We can do the back first. Nice deep breath for me. Good. Can you cough for me? Deep breath. Good, they sound nice and clear.